While you are watching this video, about 20 older adults have just been diagnosed with dementia. That means a new case occurs every 66 seconds. But the frightening truth is that the culprit is not only the natural aging process, it may actually be inside your medicine cabinet. Research from JAMA Internal Medicine shows that using certain common medications for just 2 years can increase the risk of dementia by up to 49%. A database study on hundreds of thousands of American patients revealed that seniors taking multiple anticholinergic drugs simultaneously had a 2.6 times higher risk of developing Alzheimer's disease. And brain MRI scans demonstrated that the volume of memory centers can shrink by up to 28% in less than 1 year. These numbers are not far-fetched, because as many as 99% of older adults have no idea that at least one pill in their daily regimen may be silently eroding their memory. That is exactly why today, I, Dr. Emily Carter, a geriatric physician with over 20 years of experience, will reveal the 5 most dangerous medications that accelerate cognitive decline in American seniors, ranked from the least harmful to the most devastating. Stay with me until the end, because the number 1 drug is the one I see most often in my own clinic. And don't forget to leave a comment sharing the medications you are currently taking, or if you've ever experienced sudden memory lapses or brain fog. Your story could help warn and protect millions of older adults. Now, let's begin with drug number 5. 5. Proton pump inhibitors, PPI. The first group we need to discuss is proton pump inhibitors, PPIs, with familiar names such as omeprazole, esomeprazole, and lansoprazole, which are widely prescribed for acid reflux, peptic ulcers, and chronic heartburn in older adults. The problem is that by strongly suppressing stomach acid, PPIs can lead to deficiencies in vitamin B12 and magnesiums and disrupt the gut microbiome, factors essential for brain health and memory function. A large study by Gom et al., published in JAMA Neurology 2016, found that frequent PPI users had a 44% higher risk of dementia, HR equals 1.44, compared to non-users. Meanwhile, a 2023 analysis by Mehta in gastroenterology found no significant association, showing that the evidence remains conflicting. But the most concerning issue is the sheer scale of use. In the United States, millions of people over 60 take PPIs continuously for years without ever reassessing the indication. In my clinical practice, I have often seen patients who had been on omeprazole for 5 to 7 years for nothing more than mild heartburn when they could have managed it with dietary adjustments or safer alternatives. That is why my medical advice is this: never stop PPIs abruptly on your own, but do consult your physician to evaluate whether you truly need them long-term. Consider using the lowest effective dose for the shortest duration, switching to H2 blockers if appropriate, and supplementing with vitamin B12 and magnesium when necessary. The key takeaway is this: PPIs may not be proven to cause dementia directly, but chronic overuse can unquestionably place your brain at risk. 4. Antidepressants and antipsychotics with strong anticholinergic properties. The next group of medications that poses a serious risk to brain health in adults over 60 are antidepressants and antipsychotics with strong anticholinergic effects, including familiar names such as amitriptyline, paroxetine, nortriptyline, haloperidol, and chlorpromazine. Mechanistically, these drugs inhibit the activity of acetylcholine, a crucial neurotransmitter involved in memory and learning. When acetylcholine is blocked, the brain can easily slip into a state of memory fog, confusion, and accelerated cognitive decline over time. Scientific evidence confirms this danger. A large-scale study by Coupland et al., published in JAMA Internal Medicine in 2019, found that patients with high cumulative exposure to anticholinergic medications had a 70% higher risk of developing dementia compared to non-users. Another analysis from the Humana database 2023 revealed that older adults taking multiple anticholinergic drugs simultaneously had a 2.6-fold higher risk of being diagnosed with Alzheimer's disease. What makes this group particularly concerning is that these medications are often prescribed for prevalent conditions in seniors, such as insomnia, anxiety, depression, or psychiatric disorders, meaning that many patients and even their families are unaware of the risks to cognitive health. My medical advice is clear. Older adults should avoid tricyclic antidepressants and older generation antipsychotics unless necessary. If depression treatment is required, talk to your doctor about safer alternatives, such as certain SSRIs with minimal anticholinergic activity. And most importantly, if you are currently taking these medications, monitor your memory closely and promptly consult your physician if you notice unusual confusion or sudden forgetfulness. 3. Opioids. The third group of medications that seniors over 60 must be especially cautious about are opioids, including morphine, oxycodone, hydrocodone, and fentanyl. These are powerful painkillers, often prescribed for chronic pain conditions such as osteoarthritis, back pain, or after surgery. However, with long-term use, opioids not only carry a high risk of dependence, but also directly affect the central nervous system, reducing alertness, disrupting sleep, and slowing information processing in the brain. The dangerous mechanism lies in how opioids alter dopamine and glutamate neurotransmission, which accelerates neurodegeneration. Scientific evidence strongly supports this concern. A study published in Nature Scientific Reports 2024 by O et al. Found that patients using opioids continuously for 90 days or more had a 15% increased risk of dementia, and in those over 60, the risk rose to 20%. Further evidence from Mayo Clinic Proceedings 24 showed that prolonged opioid use leads to structural changes in both white matter and gray matter, hallmarks of accelerated brain aging. In my clinical practice, I have seen many patients in their 70s prescribed oxycodone for joint pain, who, within just a few years, developed significant confusion and memory loss. Therefore, opioids should only be used short-term, at the lowest effective dose, and only when no safer options are available. Older adults should prioritize alternatives such as physical therapy, non-opioid pain relievers, or non-pharmacologic strategies. And if opioids must be used, they should be closely monitored by a physician for both pain control and cognitive function. 2. Benzodiazepines and Z-drugs. The second most dangerous group on this list is benzodiazepines such as diazepam, alprazolam, clonazepam, temazepam, and the so-called Z-drugs like zolpidem and zolpiclone. These are widely used sedatives and sleep medications, commonly prescribed for older adults suffering from insomnia, anxiety, or stress disorders. The harmful mechanism lies in how these drugs bind to GABA receptors in the brain, enhancing central nervous system inhibition. At first, patients may feel relaxed and sleep better, but over time, this suppression reduces memory capacity, causes confusion, and accelerates cognitive decline. Scientific evidence has repeatedly warned of this risk. A meta-analysis published in Mayo Clinic Proceedings found that long-term benzodiazepine use increases the risk of dementia by 38% to 78% compared to non-users. Additionally, data from the U.S. Medicare program in 2015 showed that up to 17.6% of adults over 65 were prescribed benzodiazepines at least twice in 1 year, underscoring how widespread and concerning their use is. In my own clinical practice, I have seen many cases like a 66-year-old female patient who took zolpidem for 2 years to sleep, only to later experience frequent memory lapses, forgetting her keys, mixing up the names of her grandchildren, and gradually losing her sharpness. Even more alarming, this group of drugs significantly increases the risk of falls, fractures, and even premature death in seniors. My advice is clear. Benzodiazepines and Z-drugs should only be used short-term at the lowest effective dose and only when necessary. Older adults should prioritize cognitive behavioral therapy for insomnia, sleep hygiene, and natural approaches before turning to medication. And if you are currently taking these drugs, discuss with your physician about a gradual tapering plan and safer alternatives to protect memory and mental clarity after age 60. 1. Strong anticholinergic drugs. The most dangerous group for brain health in people over 60 is strong anticholinergic drugs, commonly found in medications such as oxybutynin and tolterodine for overactive bladder, diphenhydramine in over-the-counter allergy, and cold medicines, as well as certain older antidepressants and Parkinson's medications. Mechanistically, these drugs block acetylcholine, a core neurotransmitter essential for memory formation and concentration. When acetylcholine is chronically suppressed, the brain functions as if a radio signal has been cut off. Memories fade, learning ability declines, and the risk of dementia skyrockets. Large-scale scientific evidence supports this danger. A study spanning over 10 years by Coupland et al., JAMA Internal Medicine, 2019, found that individuals with high cumulative exposure to strong anticholinergic drugs had a 49% higher risk of dementia compared to non-users. Data from the Humana database 2023 is even more alarming. Seniors taking 4 or more anticholinergic medications simultaneously had a 2.6-fold higher risk of Alzheimer's disease. What makes this group particularly insidious is that many of these medications can be purchased over the counter without a prescription, making it easy for older adults to misuse them unknowingly while damaging their memory. That is why my professional advice is, older adults should avoid strong anticholinergic medications whenever possible, if safer alternatives exist. For example, if used for urinary urgency or insomnia, talk to your doctor about options like mirabegron for overactive bladder or newer generation antihistamines with fewer effects on the brain. Most importantly, seniors and their caregivers should review the entire medicine cabinet regularly, because even a simple allergy pill can be the silent culprit, accelerating cognitive decline and dementia progression. To protect memory and reduce the risk of dementia caused by medications, the most important step is to review all prescriptions and the medicine cabinet of older adults regularly. The American Geriatric Society recommends doing this at least every 6 to 12 months, since statistics show that more than 40% of Americans over 60 are taking at least one drug that may impair cognitive function. The first step is to identify high-risk drugs, such as strong anticholinergic medications, benzodiazepines, opioids, or sedative hypnotics, and then consider switching to safer alternatives. Secondly, always aim for the lowest effective dose for the shortest possible duration, because a study in JAMA Internal Medicine 2019 demonstrated that the risk of dementia increases significantly when cumulative exposure exceeds 1,095 standardized daily doses over 10 years. Third, it is essential to strengthen the brain's defenses with balanced nutrition, regular physical activity, and proper sleep management. A review published in the British Journal of Sports Medicine in 2020 confirmed that combining consistent resistance training with a diet rich in natural protein helps maintain both cognitive performance and muscle strength in older adults. Finally, pay close attention to warning signs from patients and their families. When confusion, unusual forgetfulness, or brain fog appears, it is critical to inform the physician immediately to reassess the current medications. The bottom line is this: never stop any drug abruptly on your own, but actively discuss with your doctor a deprescribing strategy, reducing or discontinuing high-risk medications to safeguard both memory and quality of life after 60. In summary, we have now covered the 5 most common groups of drugs that can impair cognition and accelerate dementia progression in people over 60, from proton pump inhibitors, PPIs, to strong anticholinergics. The numbers from major studies such as JAMA Internal Medicine 2019 and Mayo Clinic Proceedings 2024 show that the risks are real and must not be ignored. The most important message is, do not discontinue medications on your own, but always consult your physician to find safer alternatives and minimize potential harm. If you found this information valuable, Please leave a comment about which medications you or your loved ones are currently taking, as your story could help alert thousands of other families. And don't forget to like this video, subscribe to Senior Health Zone, and turn on the notification bell so you never miss upcoming content, where I will continue to share evidence-based medical knowledge to help older adults protect their memory, heart health, and overall quality of life after 60.